Hello, welcome to the Let's Talk Kids Health Facebook Live Show, episode 15. I'm Dr. Narissa Bauer, your host. I'm a behavioral pediatrician and blogger of Let's Talk Kids Health. As you know, the concept of the show is to share information about behavioral health and wellness for children and families everywhere. And each week, I plan to bring you topics and guests to help me advance this mission so that we can all talk together. Now, remember, if you're viewing this live, you'll have the opportunity to post comments and ask questions of my guest. Just let us know anytime that you're here by dropping a comment, saying hello, and using that hashtag live. The replay will be immediately available when we end the broadcast. So if you watch and you think somebody else might benefit, please share on social media. Now, if you don't want to miss future episodes or maybe check out some of the past ones, please subscribe to my YouTube channel, Narissa Bauer MD, and follow my blog Facebook page, Let's Talk Kids Health. Okay, so now on to this week's guest. Let's welcome Dr. Amy Shriver. Dr. Shriver is a general pediatrician at Blank Children's Hospital in Des Moines, Iowa, and an assistant professor of specialty medicine at Des Moines University. A strong advocate for early child brain development and early literacy promotion, Dr. Shriver has served as a medical director for the nonprofit organization Reach Out and Read, Iowa, since 2011. Dr. Shriver is also a member of the executive board of the Iowa chapter of the American Academy of Pediatrics and the National AAP Council on Early Childhood Executive Committee. Dr. Shriver collaborates across the state with organizations such as Iowa ACEs 360 and Prevent Child Abuse Iowa to promote relational health and mitigate the effects of stress on Iowa's children and families. Thank you, Amy, for joining me on the show. I am so happy to have you.
Thanks, Narissa. It's so great to be here. I just really admire everything that you do out in the community and in your realm. And so I'm just really excited to be here and talk to you and, talk a little bit more about what's been going on recently with children's mental health and try to work through that a little bit.
Yeah. I mean, both of us are seeing a real big uptick, and I'm just really excited to have this conversation with you. So before we go into some questions, I thought maybe I'd just ask, for the benefit of our viewers who don't know you, because I have the honor of calling you my friend. But if you could just tell our viewers a little bit more about why this topic in particular. What is it about this that, just makes you want to get up every day and do this work?
I think you really said it, right? There are certain things about our jobs that really keep us motivated. And, from the very get-go in my career, I started learning about the importance of early childhood health in general, what happens in the first 5 years of a child's life, and how important relationships are to not only our physical health, but our emotional health and our future relationships. So that attachment theory and what happens between that primary care taker of the child and then how that affects that child's growth and development has been something that really has made me want to do more investigation and more support of children and families. So I started early working with Reach Out and Read, which many of you probably know is a really great organization that where pediatricians like me in primary care get to give books to children. We used to start at 6 months, but now we even start earlier than that. Hopefully we start with our advice and our book giving around age 0. And at every well child visit, we have that opportunity for that one-on-one contact with parents and caregivers and talk about the importance of sitting together, sharing these warm and fuzzy moments and bonding together and using books as a tool to do that, to enhance relational health, but also the books can provide that nourishment for the brain with the cognitive development. And so working with Reach Out and Read has really let me given me a positive outlet for talking about early relational health and a tool within my own clinic to be able to do that with my own patients. And just learning more about that has really made me aware of some of the negative effects of stress. And so we know that stress can affect you at any time in your life. And there has been no other time like this time to really understand about stress. I used to talk about stress in my clinic, and some families would get it, and some families would just be like, whatever, stress is just, that's no big deal. But ever since COVID has hit, everyone really fully understands what stress is all about. And people are much more receptive to hearing about ways that we can work towards mitigating our stress, not only for ourselves as adults, but for our children as well. So just working with the early childhood set has really helped me set the stage for the way I talk about stress. But, in the last few years, as I'm getting older, my patient population is also getting older. And I've really started to see a lot of tweens and teens having some issues. And so you can use some of the same concepts and tools that we use for early childhood and help teens and tweens deal with stress and become resilient. So, or at least enhance the resilience they already have. So that's where my interest has been kind of developed. But now in the past year, I think everyone, you and me and everyone, has really had to step up their game with how we're going to address stress and how we're going to support children and families.
Yeah, and unfortunately, I think we all know this to be true, but even though the vaccine is out and people are getting vaccinated, the mental health effects of this is going to, persist long beyond that, unfortunately, I think. So, I think this is a timely topic, so thank you for bringing it to the show and so that we can talk about it tonight.
Yes, I'm so glad that we get a chance to talk about it, and I hope that it spurs more conversations among pediatricians like me who are really working hard to figure out what to do next. And then, developmental specialists such as yourself who can actually guide us and help us with certain aspects of our management. And then, of course, among parents and caregivers, what can we do to support them right now? And if there are any tweens or teens out there, then, of course, they want to hear, what should I be doing? So.
Right. Well, so let's get to it. So the first question is, how common are mental health issues in youth?
So you probably know this as well as I do, that they are so common. And lately they've felt even more common. So we know that of all of our mental health issues, 50% of them will be diagnosed before age 14. So we know that this is a very prevalent childhood condition. And we know that there are some mental health issues that are just the most common in kids. So we know that anxiety, behavioral concerns, ADHD, and depression are kind of the four big ones that we see in the children. There are others, of course, but those are the ones that are most prevalent. And I know that you're an expert in ADHD diagnosis and management, so you probably see a lot. So you probably think it's really, really prevalent. But, I've seen statistics anywhere between 9 to 15% of children can be diagnosed with ADHD. So it's pretty common. And then somewhere around 7% of children have anxiety or behavioral issues. And depression, of course, it depends on how old you are as a child. They're the very young children, and then it gets more common as you enter your teenage years. So these are the ones that I'm always kind of keeping an eye out for, or the ones that I hear most commonly in my clinic. And I'd be interested about, what about you? Do you see these as your most common?
For sure. I mean, with ADHD, as you know, it's the most common neurobehavioral issue that we see in pediatrics, and it's just becoming much more complex too. I think we're seeing a lot more younger children, and I get a lot of those patients, the 3 to 6-year-olds that general pediatricians don't have a lot of time, to see and really dig into that and really understand, is it just early brain development, normal behavior, or is it something else? And so I'm seeing a lot of those. And then, obviously none of these exist in a vacuum, right? So the fact that you have one of these raises the likelihood that there's other things going on too. So we always have to be on the lookout for other conditions masquerading and or coexisting.
That is so true. If you have one of these concerns, then the likelihood you have 2 or even 3 is definitely there. So I feel the same that you do about these early childhood presentations of behavioral issues or neurodevelopmental issues. It is hard for general pediatricians to really dig into that. Some of our tools don't really work as well in our primary care setting for the younger crowd, right? So we do rely on some of our specialists to dig in and kind of help us to determine, what exactly is going on with this child and how can we best support them. And then, of course, for the younger crowd, therapies are really important. But as we'll get into a little bit more, access to those therapies can be just incredibly difficult for families to find and for pediatricians to refer. So So we do rely a lot on our specialists to guide us and help us figure out if we're doing the right thing with diagnosis, and then if we are able to access some of the mental health care that these children really need.
Yeah, I'm glad you mentioned that about therapy. So we'll have to talk about that because right now there's such a stress on the mental health system. Unfortunately, I know so many folks in my community, they're no longer accepting new patients because their current existing panel is struggling. And if you do get on a wait list, it can be months, and parents need something now. So, I mean, I'm feeling that, that stress, that overwhelm from families saying, I need something right now. And, you know,
yes, that's exactly how I feel in my practice is, especially if I have a tween or teenager who comes in with depression. I've had one of the tools we use in primary care is the PHQ-9, or the Patient Health Questionnaire, and that when we score those, it helps us determine, do you have symptoms of depression? Are they mild, moderate, or severe? And so many more kids are coming in with severe depression, and it's pretty nerve-wracking as a primary care doctor to know that even though what you very much need right now is both medication and therapy, that I won't be able to get you one of those two things that are very key to your success. And so pediatricians like me and groups like the Iowa chapter of the AAP are working to try and find ways to bridge over to therapy. What can we do to support children and teens and families in that waiting period where we know you have depression and we know you need treatment, but we can't get you into your therapy? So what can we do in the meantime?
mhm.
And it's something where the more tools you have as a primary care doctor, the more confident you feel. But right now, most of us are just going, oh my gosh, we need more of those tools.
Yeah, that's absolutely right. And because primary care pediatricians and providers like family physicians and nurse practitioners, you're taking care of a huge number of these patients. It's not just specialists who are seeing these kids. I mean, so many of us are detecting these issues early. And so I think it's just, I'm really happy that we're talking about this because part of it is that we rely on families to share what's their concerns, right? I mean, if we don't ask in just the right way, I always try to tell families that please, like if there is a concern, there is no concern too small, no question that's, too little, like bring those concerns up, right?
Yes, and I think that parents really would, they need to know the signs. They need to
Mhm.
know how to tell if it's time to bring your child in to talk to the doctor or not. And it's hard to recognize those signs sometimes. So I think that's something that you and I probably see a lot. So, um, when parents are kind of like, why are you behaving this way? I think you and I probably can say, well, some of the more concerning signs for something like anxiety or depression in young kids look
Mhm.
different than in older kids. So in younger kids, we see sometimes some internalizing behaviors where, you might get quieter, you might not enjoy certain activities that you used to do, you might just be just not as outgoing and gregarious and talkative as you used to be, some change in your behavior and your personality that can indicate that something's going on. And then you might have the externalizing behaviors. And from my experience, those are a little more obvious, right? And the number one that I see in the littles and in the bigger kids is irritability, right?
Yeah.
Stress of all kinds can just really make you more reactive to things and make you less tolerant, less patient, and just more likely to snap at other people and just a little less pleasant to be around, right? So, irritability is a great way for parents to say, well, is something going on, right?
Mhm. Yeah. So, I think that gets us right into, I mean, we answered this question here. So how can parents identify when their kids are having mental health struggles? I mean, one of the things that I often talk about are, first of all, empowering the families to know that they know their children, right? So if there's any change from baseline or from what they knew, it never hurts to just give a call and ask, like, I'm not quite sure. Is this just like hormones? Is this puberty? I get that question a lot too. But I always tell parents, like, think about day to day. Is your child or teen still getting pleasure from the activities they used to do? Are they just hanging out in their room and yet not it's sleeping? How is their sleep? How is their eating? Are they smiling? Are they joking with you periodically? Those are some of the red flags that I tell parents to be on the lookout for, and not just the presence, but how long it's been too.
Yes,
Yep.
absolutely. Like, so not enjoying your normal activities or not seeing your friends as much as you used to, that's definitely a sign in some older kids. And then in the younger kids, you can see some regression in behavior. So, hey, he was talking so much and now he's not talking as much, or he was totally potty trained and now he's not potty trained anymore. He was sleeping really great and now he's not sleeping anymore. So, regressing behaviors in younger kids. And then certainly across the age spectrum, if you're struggling with having your regular normal eating patterns. Some kids that are depressed or anxious will eat more and some will eat less. And then if you're struggling with sleep overall, that should be kind of one of the red flags. Why aren't you sleeping? And then obviously, if you can't get your homework done, if you are failing your classes, school failure is a big red flag for everybody to say something needs to be checked out. And then a lot of parents don't know that kids will have actual physical complaints when they have depression and anxiety. We call those somatic symptoms. So frequent headaches can be a sign. Recurrent stomach aches can be a sign of stress, anxiety, depression. So those are ways in which we don't really understand what our body's trying to tell us, right? So I always say that if you're seeing that more often, it's a great chance to go talk to your doctor. And sure, it may be something else, but that's something that we will always consider is this a lot of stress, and or do you have a mental or emotional concern?
Yeah. I'm curious, Amy, like, from your perspective, since COVID has started, are you actually seeing the same number of patients? And are you worried that some families have been not coming in because of COVID or social distancing guidelines, not being sure if it's safe to come in? Are families returning back to the office or not?
I would say no. So in March, April, and May of 2020, we were barely seeing anyone, right? No one was coming in. We hadn't quite established our telehealth services. And so we just weren't seeing anybody. And then we started getting better about reaching out to patients, and we established, these really safe protocols that made certain people feel like it was going to be okay to go see their doctor. So we started seeing more kids coming in, but we're still at about just 2/3 of our normal capacity, even a year later. And so that's a big concern, that we're missing a lot of children and especially teenagers who just are still afraid of being exposed to COVID and just not getting in there for their regular physicals and checkups. So those kids may just kind of fly under the radar for a lot of these mental health issues. And we do, in starting 12 and up, do a really good job of screening for depression. And in the younger kids, we also screen for concerns as well. So I think getting in there and seeing your doctor is a great way to make sure that those things don't go missed.
Mm-hmm. Right. Well, hopefully that'll rebound. Have parents taken to doing telehealth visits with you?
Telehealth that's one of the positive things that's come out of COVID, is that we weren't doing any real telehealth prior to COVID in my clinic. And now we've adopted it as a strategy to help parents feel safe and to provide excellent care in those situations where it's appropriate. And actually, mental and emotional concerns are a really great way to use telehealth. So now I see a lot of kids for depression, anxiety, and rechecks for, if we're managing ADHD. So I use it a lot now, and it's very convenient for families. A lot of families have multiple kids at home taking homeschooling, and so they can't just bring one kid in and leave the others at home. So it's more convenient, and it allows for easier access. And so I really think that telehealth has been a boon for the way that we can address mental health issues.
Yeah. Yeah. I mean, my whole practice is currently all telehealth. So, and as you said, I mean, I think behavioral mental health issues, it really is a nice way to do it because I get to see it, the family in their homes, and it's much more relaxed. And again, the accessibility has been wonderful. So, that brings me to the next question here. So, here we are talking a lot about what we're seeing, our concerns, this uptick in behavioral mental health issues, and I don't want parents to feel like there's no hope here. So, what can parents do to support the mental well-being of their children?
So, first things first, parents' first job is to love their kids, right? So you do not have to be a therapist to your child. You don't have to be the counselor or the diagnostician. Your job is just to provide a lot of love, right? But there are things you can do to support kids at every age to help them manage their stress. And then if they are going through a really rough patch, to help them manage that as well. So the first thing I always start with is, have you taken a look at the 7 domains of well-being? And like, just go down your checklist pretty much every day and make sure that you're kind of accomplishing all 7 as best you can. And the first one is good nutrition. The second one is getting satisfactory sleep. And I think, working moms like us, that's always like low on the list, but still very important. Make sure that you are getting your body moving. And I
Mhm.
like to say, like, movement in a really upbeat and fun way. Like, I don't want exercise to sound so terrible, right? Like, movement sounds more fun than exercise, but something that really gets your body going and gets your heart rate up. It's something that you love every day, right?
Mhm.
You should have time to relax. I've been doing a lot of anxiety screening, and one of the questions is like, do you have trouble relaxing? So I guess it's hard for a lot of us to just like fully relax. So sometimes that means you have to learn how to practice mindfulness. And I don't know about you, Narissa, but I think practicing mindfulness is really hard. So those are some, and then making sure that you're getting out into nature. And that's easier now in Iowa that it's May, but just last week it snowed. So, it's been a rough winter for Iowans. And then relationships, so important. And we can talk for hours about what that means. But then finally, as a parent, if you've done all those 6, the 7th one is just to do a mental health check, right? And to say, where is my child with their mental health? Should I be taking them in and having them evaluated? There's really no downside to doing that, right? If you're worried, if you're seeing some of those warning signs that we talked about, then that's really your job. You don't have to manage the mental health. You just have to recognize some of the signs and then make sure that you have a place like a primary care doctor's office where you can go just to have that conversation and figure that out.
Yeah, I really love how you started off that answer. I mean, the whole answer was lovely and it has so many pearls in there, but the fact that you said just be the parent first, like you can connect with your child. You don't have to be that therapist. And I really value that because a lot of even just the things that I do when I'm working with families is really focusing on that mindfulness of our own thoughts, feelings, that reactivity that we bring to a interaction, and really focusing on effective communication. And so that face-to-face time is very critical.
And actually that brings me to one of my other little tips that I've been using for myself
Uh-huh.
as well as for my patients is what's called mindful listening.
Mhm.
So, I mean, listening, sure, like everybody's listening, but what is mindful listening? And that's when you listen to someone and you turn off that part of your brain that is thinking of the next thing that you're going to say. And for a doctor, I mean, I'm always thinking, what's the next thing? What's the next thing? What's the next thing? It's very hard to just listen and turn off all that other noise. And so, but that's what I've been working on as a parent and as a provider. And that's what I help my families work on as well, is if you can just turn off that little noise and like just sit there with your child and do some listening. And I know for teens and tweens, they don't always share automatically. But one of my teen patients said, "Mom, we need to go for a car ride because we need to have a talk." And really, honestly, car rides are a great opportunity to talk to your teen because they don't have to look you in the eye, but you're still a captive audience. So that's a good tip for if you're wanting to listen to your teens, but it's like not going great and they won't just sit there and stare at you. Just take them on a car ride.
Yep, I love it. And the fact that the teenager suggested it.
I know. She's beyond her years. She was very wise.
Well, Amy, it's funny that you say that because I just finished, well, we're in the middle, we're almost done. Tomorrow is the last day of my 2-week mindful listening challenge that I was doing. I know, in my parenting discussion group, in my Facebook group, because again, I think this is like the first critical step to really making sure that you connect with each other, whether it's your child, whether it's a spouse, whether it's a patient. We all can practice mindful listening. And I love how you described it, turning off those extra thoughts and really making an intention to go into that interaction, just focusing on that person. Because we live in such a busy world with technology dings and screens and everything commanding our attention. And sometimes we just need to have that face-to-face time. So, yeah. So I'm curious, like when you do introduce that to families, do they take you up on it? Do they want to practice?
Well, it's a great suggestion out there. I don't know yet if they're practicing it or not, because it's pretty new for me too. I mean, I'm certainly trying to practice it, but I don't know how well it's going for them yet. But I can tell you, like, some pediatricians are really good at talking about these things with their families, and some don't have like a framework for talking about stress or mental health. And so what I like to do is use a framework that is called CC123, because talking about stress can be a downer. It can be a little bit guilt-inducing sometimes, or it can just be a stressful topic in general. But when I use my CC123, it's very strengths-based, and it's a way to help parents and caregivers reflect a little bit on parenting and about what they can do to support their kids. So that's what I'm trying to get other providers to think about when they introduce the topic, because it's a pretty easy mnemonic to remember. And so it's something like, it goes like this. So the first C is, this is your framework for dealing with stress, right? And supporting resilient kids during stressful times. The first C is connections, just like you talked about, right? Connecting with your child, but then also making sure in a 2-generation way that both the parent and the child have solid connections with friends. So it's very important that parents like work on their connections, especially, working moms. They're so like thinking about other people. They don't always do the self-care of taking care of themselves. So connections are important for parents. Connections are extremely important for our teens and tweens right now who are very socially isolated. So working on how to do that safely with the social distancing guidelines that are still recommended.
Yep.
But it's really, really important to do that. And then the second C is coping skills. And I know that you are an expert in helping families develop good coping skills. What I tell the parents of young kids is that routines and rituals are a great way to start for thinking about coping skills for young kids. They feel safe, they feel secure when they know what's coming next, and it just helps them deal with their big emotions because they know what's going to happen in their life. And frankly, it's good for me too. I like a little bit of a routine.
Mm-hmm.
And rituals are those tweaks in your routine that make it special for your family, right? That's just unique to you guys. You do something to only you guys do that. And it's something that when you grow up, you look back on your childhood and they're like, oh, remember that? That was so special that we always did that. So I think the ritual part's really special. And so I invite families to reflect on their own rituals and think about incorporating new rituals to make things feel not only routine, but like sort of fun and special too.
Yep.
So part of that coping mechanism is don't forget to have fun with your life. COVID is like not fun. Everybody knows COVID's the worst, but there's still ways to make your relationships fun at home and try to have fun. So that's an important part of coping. And then just briefly, 1, 2, 3. The first one is to take one moment, especially if your child or your teen is acting out or they're doing something you don't like, which is a lot.
Mhm.
And just take one moment as a parent to reflect on that and say, is this due to stress? Like, are they having a COVID moment right now? And then to try and take a step back and just forgive yourself for not being a perfect parent and forgive the child for not being a perfect child, and to understand that stress makes us do things that we wouldn't otherwise do. So take that moment to empathize, see if you can forgive, and then you can either be a nitpicking parent or you can be a parent who like only picks at the very like most important things. So during COVID, it's really kind of more helpful if you steer towards that, like address the really important issues. And if it's not that important, can you just be forgiving? So that's the taking one moment. And then 2 is 2 eyes for seeing and 2 arms for holding. So, we all just need a little more positive affirmation. We need a little more hugging. And so not everyone's into hugs, so you have to kind of read the room. But
Mhm.
I love hugs. So
Me too.
when I'm stressed out, I need about 10%, 20% more hugs. So, but it's just nice to think about that as a parent, like my kid really needs my hugs. They need my eyeballs on them. They need to have me present with them. And likewise, I tell the older kids, your mom could use a hug right now. Your dad could
Mhm.
use a hug right now. And then 3 is, what are 3 ways that you can show your child you love them every day? This parenting gig is not just a part-time gig, it's a full-time gig. So it's an everyday gig. You don't have to like have a big parade, but like what are just little ways that you can show them or tell them or do something for them as a gesture? And I always ask parents to really think about that themselves, as that kind of
Mhm.
promotes that reflective parenting. And plus, it's none of my business really, but like I really want you to do what you want to do, not what I want you to do.
Right.
So, and then for older kids, I ask them. And the older kids, they're so smart. This is what they always say. They're like, I could help more around the house. And that is the correct answer, kids. You can help more around the house. So CC123, it's not perfect. I also talk a lot about shared reading.
Mhm.
Now, my kids are 10 and 13. Seems a little old for the shared reading, but we still read together every night because books are amazing.
Yes.
And those older books for older tweens and teens are actually really good. And we just finished reading one called Fish in a Tree. And that was such a great book about a child growing up with dyslexia. And it
Mhm.
really gave me a new perspective on it, both as a parent and as a provider. So I'm all for shared reading as one of those ways.
I love it. Did you come up with this framework yourself?
Yeah, this is one that I created. I think I used Ken Ginsberg's 7 C's of resilience.
Yes.
So I can't remember 7. That's a lot of C's. I can remember a lot of the C's, and I do think that his 7 C's are really helpful, especially when you're dealing with a teen who is struggling with depression,
Mhm.
because he talks a lot about giving your child agency. It's that agency starts with an A, so control is actually the word. But making sure your child has some way of contributing to the world and is building confidence and competence. So right now, what our tweens and teens are doing a lot of is being alone at home on their phone.
Mhm.
And it's kind of like an existential crisis. Like, why are we here? What are we even doing? But when kids are out there like setting goals for themselves, if it's with sports, if it's with activities, if it's with volunteering, the goal setting, the like having little achievements, or the feeling that I'm making a difference somewhere in the world is a buffer against some of these issues that we've seen coming up. It doesn't solve all of the problems. I mean, depression is real and it's serious, but these are some things that teens really need in their lives to feel more resilient.
Mhm. I mean, it's a beautiful framework. For those of you listening that are pediatricians, providers, please start, using it. I think it fits well, especially with busy primary care, visits, because it's just a nice, simple way of remembering to bring that strength-based lens to all of those encounters. So, but
Yeah.
I think. One of the ongoing questions is, we're living in COVID. Obviously, it's trauma. It's trauma for everybody, I mean, nobody ever imagined us dealing with this and for this long, right? So I'm going to just kind of bridge into our last part of the interview is, what is trauma-informed care before then we move into, talking about how pediatricians can support families?
So trauma-informed care is a lens, just like you said. It's a way of approaching working with others. So it can be applied in primary care, it can be applied in all across medicine. It can be applied in childcare settings, in schools, in workplaces, right? It's really useful in the business community, in the education community, in the health community, and really everywhere. It's a lens to say not what's wrong with you, but what happened to you if you're having some trouble concentrating, if you're having anxiety issues, if you're having anger issues, if you're not performing well in school, if there's something going on with you, instead of blaming and shaming the person by saying, what is wrong with you? You're a weirdo. Why are you acting that way? I don't like it. Like there's a problem with you as a person. And it rewinds all of that. And it says, actually, when people behave that way, it's because probably something really terrible happened to them, right? It explains like almost all of the bullies of the world, right? The insecure bullies of the world are acting that way because something bad has happened to them in their life and nobody has helped them, right? And so it's not a pity party. It's not a like, oh, I'm sure that like, you must have been abused. It's not a view of any of that. It's just saying, I'm actually going to try and understand you
Yep.
and help you and support you rather than blame you, shame you, or just not like you very well, right? So this applies to our patients quite often, right? So if a patient comes in and they're struggling, it's important to just have that lens to say, maybe there's something in their past that has happened to them that requires me to dig deeper, that requires me to have sensitivity to their needs, or requires maybe me to refer them to some type of therapy. So that's part of it. And the other important part of trauma-informed care is not just saying what's wrong with you. The newer way of looking at it is also to say, what's strong with you? Like what are the things about you that are going well, that are that you love about yourself? So there's definitely the lens of like making sure you're thinking that this person could have had something happen to them to explain what's going on, but also that that's not defining them. That doesn't define who they are. And it certainly doesn't define what future they have. But trauma-informed care is really helpful for me because a lot of times, there'll be policies in place at my workplace, right? Like if you are 15 minutes late, then you get a no-show. If you get 3 no-shows, then you're kicked out of the practice. Those are some rules that have existed in the past, or rules that primary care doctors kind of need, because if people no-show all the time, then that's not a good way to run the show. But being trauma-informed means to say, well, why are you no-showing all of the time? And do you need some help with that? Can I refer you to my social worker? Is it a transportation concern? Are you working 3 jobs? Like, is it that you have too many kids and you can't bring them all in because of COVID? There's like a million reasons why someone wouldn't show up. Most of my patients are taking like 3 buses to come see me, and so they miss the bus, So just, you can have trauma-informed care in your practice, not only one-on-one with patients, but as policies go, to make sure that your patients get the care that they need, and that you're not ignoring some of those deeper root causes and those social determinants of health, many of which are based in a lot of stress and trauma.
Yeah, thank you. I think that's a very good description, and I love, the strength-based, in addition to sort of just being more sensitive or getting more curious about what those underlying issues are, rather than putting the blame on the person. So that was a very clear answer. Thank you. So again, we sort of started talking about this. So how can pediatricians support their patients of all ages and families during this stressful time, or any trauma?
So first step is to have the knowledge base and the confidence as a primary care doctor to be able to talk about stress, because I think many providers haven't been trained in that discussion, and so they shy away from doing that, right? Because they don't feel skilled enough, or they know all of it, but they may not have the resources to support families who are in need. So we have a program with Iowa ACEs 360 called the Pediatric Project, and it has 4 pillars to it. The first pillar is education. So we as providers need to educate ourselves, and we need to make sure that our staff and our entire health system is educated on trauma-informed care and what that looks like and what it means for the way we manage patients and the way we help and support them. And then we have to be able to educate our patients as well, because the more you know about the effects of trauma on your body and the ways to heal that, the more empowered you can become and the more you understand yourself and your behaviors. And then the second pillar is assessment, right? So if you know about it, but you don't even check, then what's the point of even knowing about it, right? So you have to have a really effective method for assessing for stress. You can do ACEs screening. We do it in our clinic. You can screen for social determinants of health or current stressors. There's many ways that can look, but assessing that is really important. And I like to do a universal assessment. In fact, when trauma-informed care gets employed in your workplace, we employ universal precautions. You don't just screen those people you think maybe have it, because everyone could have it, right? It's so common. 2/3 of us all have at least one adverse childhood experience in our life. So universal precautions, it means everyone could have trauma. So you just don't know who has it, who doesn't. So treat everyone like they do. So the third pillar after assessment is resource and referrals. And that's a tricky one, right? Depending on where you practice. Some people are just full of opportunities for resource and referral. Like in our clinic, we have an integrated behavioral health specialist. Like it's one of the best things about where I work is that if I know someone needs something, there's a warm body right next to me that I can just hand them off to, but not everybody has that in their primary care office, right? So making sure that piece is in place so that if you do identify someone who's food insecure or someone who has issues with housing, someone who needs support with their insurance, there's so many issues that cause stress and trauma. So making sure that you have a great workflow for what to do when those assessments come back. And the final one is about climate and culture, right? And we already talked about that a little. Can you make policies in your clinic that are trauma informed so that you don't fire all your patients who can't get there on time, or you do have privacy in place so that people feel safe? Right? You need to feel safe. You need to feel secure. You need to not be re-traumatized. So these are all considerations in your climate and culture. Systemic racism is a huge cause of trauma. And so if you're in Iowa, like I am, we don't have a lot of representation in medicine. So a lot of our physicians or other providers don't look like our patients. And so, working on issues like getting improved representation in the medical field is important. And then making sure that your clinic has a way of making people of all backgrounds feel safe, right? It could be posters, it could be messaging, it could be the books that you're handing out that have, multicultural representations or multi-gendered representations. It could be a pin that you wear, but some way you need to help your patients feel that they're welcome, that they're safe, and that you will be an ally for them no matter what.
That's so important, especially in today's society. It is so important. So that it's I love this conversation because I think one, it showcases the many things that pediatricians have to be thinking about. It's not just the patient in front of them, but everything about the experience, what else is going on in the family's community, right? We know that child health is impacted by so many of those ecosystems that we live in that we can't ignore. All of the things that we're seeing happening today. COVID being the primary one right now. So,
in talking about that, you have said so eloquently how telehealth has helped you access some of some more of the home environment, and you can get a better feel for, that bigger picture of the child, where they live in their home, in their community, and in their family, and how much that can impact their health. I know we've talked a lot about teens and adolescents. My heart, of course, is with them, but one of my biggest passions is early childhood. And one of the things that has been a huge tool for me during COVID to help pass along to my families is, a lot of these families are trying to work from home and teach their kids, or watching their very young kids while they're working from home, and they want to do their best job, but they may not have all the resources, or maybe they just need more resources. So for the 0 to 5 population, one of the greatest tools that I've come across recently that supports parents and children 0 to 5 is Sesame Street and Communities.
Mm-hmm.
So, it's a website. It's not an app yet, but it's a website. And if you go there, every single tool on there, whether it's a video or an article or some printable activity, or a storybook, all of them are completely designed to support your child's social and emotional health, and to help parents answer some questions about difficult behaviors, to support their learning, to support their body's growth and their mind's growth, and to deal with some of those really difficult behaviors that we see in the 0 to 5 population. So one of the new tools on there is about racial justice and racial literacy. And so whereas before I didn't have a lot of very much go to this place to answer your questions about how do I feel about my body, how do I feel about the way I look, Sesame Street has really tapped into that, and it's free for everybody, and it's just right on that. You can go there right now. So I actually will, during some of my exams, will just pull it up for the kids to look at and for the parents to look at. And it's been a really great addition to my practice to support children and families during times of stress.
Yeah, thank you for bringing that. And I'll make sure to include that link in the show notes so that way the viewers of this video or listening to this will have access to it. I think you're absolutely right. I mean, I think primary care pediatricians really do love those brief tools that are evidence-based that they can quickly access and provide to their families. And what's better is, the fact that they can access it and share it, to dad who might not have come, or grandma who sometimes helps, and they can also get that information. So, and I love that it's multimedia too. So it comes in lots of different formats.
Yep. And the best part about it, we haven't even said, is that it's fuzzy. I mean, who doesn't love a Muppet?
I know.
There's a video on there, Narissa, if you haven't watched it yet. It's called Belly Breathe, and it's a song, and it's got Camila Cabello and Elmo singing a duet about how you should teach how to learn how to belly breathe when you're upset. And every time I see it, I get so happy that I want to cry, because first of all, Muppets, but second of all, just I see all these young kids learning how to belly breathe and regulate their emotions, and it just makes me so happy to see that's on that video, and that it's accessible and easy to learn. It just gives me so much hope, because as a parent, it falls upon us to help our kids, right, learn how to understand their emotions and regulate their emotions, and it's such a hard job. And so if Elmo's going to help me do that, then thank you so much, right?
Yeah. Well, and we can also do it too, right? At the same time. So it's like a family activity. So
yeah, that belly breathing helps me out a lot. And as a matter of fact, I'm sure you teach in your practice a lot of techniques for calming yourself when you're anxious. So that's another one that I use is square breathing. Do you do any square breathing?
I do square breathing. I do finger breathing. I don't know if you do that one too, but
show me the finger breathing.
Okay, well, finger breathing, I just teach like this, and I hold it up to the camera, and I say, we're going to start here, and every time we move up the finger, you're going to take an inhale, pause, exhale. Then do the same as you go through all 5, right? And what happens is when you're done, if you don't feel like you're completely calm, guess what? You have the other hand, right?
2 hands. That's
2
great.
hands. And
I knew we had 2 for a reason.
Right. And I also tell kids too, even though I'm teaching you like this, you don't have to hold your hand up every time you do it. You can do it under the desk. You can just kind of do it when you're laying in bed, and just kind of, it just is a reminder of what breath you're on, because sometimes when you're first learning how to breathe intentionally, it takes a lot of mind power, to sort of do that. And so this at least gives them a template, so to
I like
speak,
that.
of doing that.
I told you mindfulness is hard for me. That's why I love these techniques, because I think when you're focused on your hand, it helps push out some of the worries about the past and some of the worries about the future and keeps you in the moment, right?
Yeah.
It's something I need to work on always, right? So that's why I liked the square breathing, and now I like the hand breathing too. And I actually learned another interesting breathing tip, which is I think it's called like sobbing breathing or gasping breathing. So we both know this, that when you take a breath in, your heart rate accelerates as part of your sympathetic nervous system. And then when you breathe out, your parasympathetic nervous system slows your heart down. So the more out breathing you do, the slower your heart rate, and then the more relaxed you feel. So when young children cry, you know that they sob, right? They go, right? And so that is actually a calming technique for them, because the breaths in will speed their heart rate up, but that like long sigh all the way out slows their heart rate down. And I was like, oh, is that why we breathe like that? I didn't know. So even if you're not actually crying, if you do that that kind of breath, it can work in the very same way. So that
Yeah.
was a new breathing technique I just picked up.
I love it. I love it. And thanks for sharing that, because I think too that that sound can be really like, oh my gosh, I need to go, help them. But really, if you can, just allow them to have that longer exhale.
Yes.
Yeah.
Yes. And I think that you and I maybe have discussed this already, but tears need a total reframe, right? The whole idea of crying needs a reframe, because we all think as parents that and as people that crying something you do when you feel sad or bad, right?
Mhm.
But really, crying actually is something you do to feel better. And crying makes you feel better when you're done. And so this is my new reframe. Also, parents get very triggered when their child is crying. And so
Mhm.
I think parents out there, you need to take a pause when you feel triggered like that, and know that like your kid's going to be okay, and it's this is a time for them to like heal and feel better. So try not to let your emotions kind of get tangled up in what's going on. I don't know if you've called it Q-tipping before, but I use the term Q-tip a lot, which means quit taking it personally. As a parent, if you can separate your own emotions and be the person who's like got their emotional lid or container on, then
Yep.
you're going to be able to better help your child. So if you're feeling triggered, try to just Q-tip it and like put your lid back on.
Yeah, it's so important. I mean, especially now too, that reactivity piece that we talked about earlier, and just being mindful of how we're going into a situation, to taking that extra breath and that
Right.
moment, right, to
And
center ourselves.
And I think that the giving yourself grace and forgiveness is also very important. Because as a parent of a child who is pretty difficult in the toddlery age, um, I blew my lid like way more than I ever thought I would, right? And so, what I learned through my early childhood work is that actually there's so much benefit to the repair that comes after you do that. So, I know you feel guilty as a parent when you blow your lid. You're like, oh, what a bad parent am I? But if you are able to come back to your child calmly and apologize and say, I'm really sorry. I blew my lid. I should not have done that. I feel really sorry. Will you forgive me? Let's hug it out. And then what that teaches your child is that it's okay to make mistakes. It's
Mhm.
okay to have big emotions, and that there is repair afterwards. So not every relationship will be irreparably damaged if you get upset, and that you can apologize, you can forgive, and you can repair. And that's a very important lesson for kids to learn, and it's really important for families to know that it's okay to apologize to your kid.
Absolutely. Amen. Thank you for saying that. I say that all the time. I mean, and I had a child who had like she's very spirited and had very long, long tantrums. And, at times I was like, oh my gosh, if anybody ever saw this right now, right?
Right.
But yeah, but, she's very emotional. She's, but, we got through it. And the thing is that I always tell parents, kids are always watching, they're always picking up on the good, the bad, and everything in between, but they love you so much. You are their first teacher. You are their most beloved teacher. And again, just that self-compassion for yourself And that
Mhm.
empathy for your child can go a very long way, showing them this is how
Mhm.
I do it. We all have these strong emotions, but I can say sorry. I can connect again with you. And, I think that is the most valuable thing and parents sometimes are like, oh my gosh, like, thank you. I'm on 24/7, but nobody's perfect, right?
Right?
Yeah. Yeah.
It sounds like our kids maybe could have gotten along really well, because
Yeah.
that sounds so familiar to me.
Yeah.
But one thing that I found has really helped my child as she's grown up is to make sure I take the time to tell her what makes me feel warm and fuzzy about her,
Uh-huh.
right? So, oh my gosh, when you sit on my lap and cuddle with me, I feel warm and fuzzy inside. That makes me feel happy. It makes me feel relaxed. It makes me feel joyful. And I think that's so important for parents to verbalize that to their kids, because inside, almost every kid really wants to
They
make
want
their
that.
parent feel that way. So
Yes.
why aren't you telling them? Just tell them. Just tell them that it makes you feel good when they do those things. They'll do them more. They'll do
Yeah.
them more when you tell them.
Yeah, that's great. I love it because, nobody can read each other's minds.
Right. Right.
So, yeah. Yeah.
And they need to feel valued. Like, my daughter knows that when I come home from work, like, I'm kind of a sponge. I absorb a lot of the stuff I hear at work, and I'm asking all the questions, so I'm hearing a lot of the stuff. So I come home and whew, I have a lot of emotions going on.
Mhm.
And so if she just takes the time, and she's 10, so she's kind of bigger, right? But she still sits on my lap. And when she does it, I feel all the tension just kind of flow out of me. So there's a lot of value in that time for her to know that she has that power to make me feel better. But
Mhm.
also, it's really good for me too, because I need the hugs. I told you I need the hugs. So,
I know. If we could, I would hug you right now, Amy.
oh, all right. Well, I'm taking the rain check. I have that. My coupon for free
That's
hug.
right. That's right. Oh, well, thank you for this lovely conversation. I mean, it was full of, so many little pearls in there, and I'm sure that people watching will share this widely. And, I think even pediatricians and family physicians and other people on the front lines who are just, dealing with this stress because it's been so long.
Right.
It's going on for so long,
And
right?
frankly, I think, Narissa, that for me, this is a bit therapeutic,
Yeah.
right? One of the techniques for adults for self care is to make sure they're connected. And not only that, but there's a specific technique for if you've had a particularly stressful day or moment, if you can connect with someone who shares your professional experiences, for example, or
Mhm.
even personal parenting experiences. And if you tell them everything, that's called sliming. So if you're going to slime someone, if I'm going to call you up and be like, Narissa, I have to slime you, it's really important to first check in with the person that you're calling and
Mhm.
say, um, is this a good time? I really need to slime you, but is it a good time? Because
Yes.
you don't know what's going on in the other person's life. It might be a terrible time to slime someone. So always check in, see what their emotional, abilities are at that moment. And then if they're okay to slime, or they'll say, slime me in 15 minutes, right? But this is one of my number one self-care tips for myself, is find someone who gets it and just get it all out there. And then I just feel better.
I know. I do too. Well, for the record, you can slime me anytime.
Thank you. Likewise, likewise.
Well, so thanks so much. And I just want to say, next week's special guest I have is going to be another great friend, Linda Akers, where we're going to actually talk about hypnotherapy in pediatrics, but it's at a special time. Tune in Saturday, May 8th at 11 a.m. and you don't want to miss it. All right. So if you are watching or if you have any suggestions for future guest topics, please feel free to reach out at letstalkkidshealth@gmail.com. Drop me a comment below, message me on social media, and just remember, please consider subscribing to my YouTube channel and be alerted every time I go live on my Facebook page or YouTube channel. Again, Amy, thank you so much. Thank you. It's been a
Thanks for
pleasure.
Thanks for having me on, Narissa. Your show is the best. I want to know about hypnotherapy. I can't wait.
Well, then tune in next week. Thank you.